Next year I will have been practicing for 30 years as an ophthalmologist. I also work in the University Department of Ophthalmology and I'm currently the President of AMA Victoria. One of the things that we're obviously concerned about nowadays is just making sure that people with disabilities get adequate support. In the ophthalmology world, that really involves us engaging with Vision Australia. So I urge all my colleagues to think about how they might engage more effectively with Vision Australia and refer more of their patients there to ensure that they get the most benefit. I think that any field loss that's encroaching within the sort of central, 15 to 20 degrees is likely to cause some impairment, and that would be where I would start to initiate a conversation with people about actually engaging with Vision Australia and seeing if they can get some extra help. You can go online from your consulting room, go to the Vision Australia website, just click referral, and in a minute it's completed and on its way. So Vision Australia has been very good at educating patients to manage the visual loss. Giving them training to sort of navigate safely on public transport, that sort of thing has been, I think, the very key thing that's been possible. I think people need to be referred reasonably early on in their journey. Vision Australia are really the specialists in that area, and we acknowledge that we can achieve a lot more in partnership with Vision Australia rather than trying to compete and provide similar services. In terms of meaningful outcomes, I think that I've seen very few patients who haven't got some benefit, but there are a couple of patients over the years who particularly benefited and been able to continue their employment, for example, or continue navigating public transport when otherwise they wouldn't have been able to do so. I think the more that you can do to engage with an agency like Vision Australia, in my opinion, is very good risk management as well. And that's what I think closing a loop is. It's not just about managing the condition, it's about managing the patient's circumstances and how they're coping.